Good afternoon. Thank you very much for having me here. It's my great pleasure to be at the School of Social Service Administration at the University of Chicago. I have to say, University of Chicago, this particular school has always been a mystery for me for the past 2 years. I'll give you a quick story. My previous professor, Professor Curtis McMillan, also my former work neighbor. We shared a wall at work before, and then in our house we also live on the same block. About 2 years ago, if I'm not mistaken, he was recruited over here and sold a house and dumped us in St. Louis, and I was joking. We are still recovering, not recovered yet. And then 6 months ago, Fred was recruited here. So I was just thinking, what is the magic of this particular school? Then I came over here. I heard the dean speaking, and I heard Dean Shaskin talking about strategic initiatives, and we heard Professor Samuel was talking about strategic recruitment, and I heard about faculty, their work, and the students. I understood. But I'm very pleased to be here to be at this conference. So thank you, Fred, for inviting me here. Since this session is about the center's work, so I represent my Center for Social Development at Washington University. This is a picture about our global presence. And my talk is more about the economic strengthening part of the conference. Every time when I share the international work of our center, I always mention about Fred's story. Like this professor mentioned about his personal story, and now I heard your story. It's really a story of inspiration and hope. And sometimes I joke with, I saw Fred in the field, and I saw those people following him and just admiring him and then it just, for those people, they think, like this professor mentioned, for those girls, maybe for those kids, they're back home. They think coming to the United States, getting a degree, not to mention being a professor at a distinguished universities, that's just an unattainable dream. But you all have set examples and make them feel it's doable. At least, we can dream about it. If not, we can reach it. So today, as you can see, we have quite a lot of international presence, but I don't want to give them all. I just want to give a few highlights. For this particular audience, I know it seems not necessary to give the why, but usually when I give the presentations about our work, a lot of questions I heard is, why do we even care about assets? Why assets? Is the income sufficient? And we'll always say, no, they are really not contradictory. They are really complementary. In the industrial era, income and consumption was critical and did a lot of good work, essential for families to be sustainable and improve their well-being. However, for the long-term improvement and the development, we can think about assets as well. And it's critically important to think about those households and think about those individuals, families. If they want to develop in long-term, they need to have a little bit resources so that they can invest. And we heard a lot of panelists talking about asset effects, such as the future orientation. If you can't even dream toward thinking about the future 3 years or even 6 years ahead of you, how can you even develop down the road? And in the policy world, a lot of people say, do policies exist at all? And yes, they do. For example, in the United States, we just passed the tax return day, April the 15th, and I'm sure a lot of, if not everyone sitting in the sitting in the conference room right now, you all get tax returns, and we all get when we invest, buy a home, and we get also tax incentives. Yes, they do exist, but predominantly those asset building policies are established for the well-off people, and predominantly for those people who have some assets already, and for those low-income people, they also equally deserve it, but they don't necessarily have the opportunity to have the access. So my boss and a very renowned professor, Professor Michael Schraden, 25 years ago, he thought, why don't we have the policy available to the entire population, especially those, the poor people, vulnerable children, and then adolescents in those households. So he had this idea. He thought his brainchild is called the individual development accounts. It's a special savings account specifically designed to start at the birth and have subsidies, special subsidies for the poor and for specific development purposes. For example, home and then education and then small business. And then later on, the funders came in and then had a demonstration called the American Dream demonstration in the United States. And his detailed thoughts about this idea were articulated in the book Assets for the Poor, Assets in the Poor book. And later on, this on the right is the Chinese translation. So today I want to show a few international examples how this idea originated from the United States and then got experimented in the global context. So I will start with the United Kingdom, and in the United Kingdom they have equivalent of individual development accounts for adults. It's called a savings gateway. They also have another version for the children called a child trust fund, and this child trust fund was the first truly universal and progressive asset building policy in the whole world. This was launched in 2004. Unfortunately, due to the political landscape change, it was discontinued a couple years ago by the coalition government. We heard about from a Nigeria case this just right before the lunch session. Government changes, and then the plans just changed. So you never know. There's unpredictable factors in the policy era. And then in South Korea, there's the national government launched the child development accounts, and the specific target for the institutionalized children for across all South Korea. And the Seoul government official, they also launched the Hope Development Accounts as a copy for the national model. And this particular Hope Development Accounts won the 2010 UN Public Service Award. So this is just a visual picture, probably not with the reflection. It's a little bit hard to say, but the idea is to show from Seoul, the idea came into Seoul and then spread to other places, and then specifically there are cities focusing on the child savings accounts. And then quickly to China, which that's my home country, and I'm very proud to say that the idea came, the asset building idea was introduced through an academic conference in 2004 in partnership with the Chinese Academy of Social Sciences and Shandong University, and then quickly attracted a lot of attention through policymakers and academic scholars and the practitioners. So this is a picture at the 21st century, and the premier Wen Jiabao was speaking, and the asset building idea was presented here as well. And then we participated also. This is really hard to see with the reflection. And this is a policy conference. So the idea is it's like many speakers alluded, it's an academic idea, but we hope to, using the policy, influence the policy, inform the policy, and then using the policy infrastructure to benefit the greater population. This is a conference, just to show a picture, this is a conference we had at the Peking University, and it's very interesting. I also shared with Dean Shaskin. This background is red, and I remember earlier in this year when you guys had when the University of Chicago had a conference at the Beijing University, a friend of mine just sent a picture with the similar background as well, so I thought it was quite interesting. Anyhow, this is a picture showing the regional conference about the asset building, about asset building innovations and then experiments. We also found through our work in particular in China or Chinese-speaking countries in the region, we found that Chinese language materials is very effective. It's one thing you have the English concept, you have the English materials, but it's 10 times more effective once you have the materials in front of those people. People can just read and resonate. Quickly, just to show research we did in Xinjiang, Western China, and this is a research project. We collaborate with the Chinese Academy of Social Sciences. This is really assets in rural retirement security scheme, and used for specifically agricultural and household investment. And this in Hong Kong. Just want to quickly show in the Greater China. So in Hong Kong, the Hong Kong government launched the Child Development Fund in 2008 as a follow model to the UK 2005 Child Trust Fund. Is again to encourage children to plan for the future and to develop accumulate assets. And this. The next one is a visual picture about Taipei, the idea, how the policy idea, asset building idea came into Taipei city, the capital city, and then later on spread to other cities in Taiwan. And then specifically, there are several Taipei city government, and then Kaohsiung city government and Taoyuan have some specific children and adolescent specific programs. And finally, I want to show the USAVE initiative. The USAVE, I want to quickly recognize a couple of my colleagues in the audience. Corinne from the Save Children Kenya, and Cassio from Postbank. So this is a multi-year project. We started in 2010 and go through next year. It's a 5-year project that promoting financial asset building for low-income youth aged between 12 and 18. And we operate in Colombia, Ghana, Kenya, and Nepal. We have a US-based consortium, but we work with in-country partners, and Cassio is a representative of the financial institutions we work with. I also have a picture of the USAVE partner, and we work with very close for research. For the Center for Social Development, our role is to do research, and we work with research partners. I specifically chose this picture because I was a colleague of us from Kenya, Kipra, was going to be here, Moses, but unfortunately, with unexpected reason, he couldn't come. But he was the one sitting at the very right, and Fred is the second, the front row as from the left. Just want to show you very quickly about what we do here, and we are one thing where with the goals of the learning agenda, we're very proud of the international research partnerships we have had throughout this project. And we had the opportunity to work with very competent, very committed researchers, and in this, and the goal of this particular learning agenda is to document the uptake, savings patterns, and outcomes of the youth savings accounts on youth participants in their financial institutions. And as I said, the Postbank is one of our, in Kenya, is our participating partner banks. And in Africa, we also have another country in Ghana, and the partner is for the research is University of Ghana, and the specific institution is called the ESER. I'm sure a lot of you know that. And then that's where the impact study is happening, and we will have more results from this particular research next year when the end-line research is completed. So just wrap it up and a few takeaways. Asset building, this research is emerging initially as a research concept, and then now as an innovative policy idea. And then there's a great potential to benefit the large population if this policy gets more visibility worldwide. And there's a growing body of international research. We're very pleased to hear quite a lot of presentations today touch base on this idea. And then obviously this presents great cross-learning opportunities. So once again, I want to thank everybody for having me here. Thank you.
thank you to each of our panelists for such interesting presentations. You all are involved in such important and meaningful work. I've been instructed that we have time for 2 or 3 questions. So on your mark, get set, go. Who wants to start?
Thank you. I have a quick question for presenter from South Africa. You've mentioned the comparison in savings. Can you please elaborate whether you had administrative data on savings? If yes, then how did you manage to collect administrative data on savings for the control group? Thank you.
Do you want to collect a few first?
Sure.
Does anybody else have a question? Okay, maybe we can just answer.
Okay. Thank you. Is this working?
I think
Okay.
so. You have to be kind of close.
Okay. Okay, thank you for that question. I'll redeem one of the more mangled results I ever presented in a presentation. We collected both administrative data for people participating in the program in the treatment groups, and we would use that administrative data to drive the incentive payments. But as part of the independent evaluation, we collected self-reported data on savings. So in doing the difference in difference estimates, we had to use consistent indicators across treatments and control. And so for that, we used self-reported data. But we were then able to compare the self-reported data to the administrative data, which we have through an arrangement with the banks. We get permission to access their bank account information, and we could corroborate the biases in the self-reported data.
I actually have a question for all of you, if that's okay. Sure. Okay. So, you know, one of the things that I've been impressed with is this whole idea about cross-sectional collaboration, and that when you do interventions, to not do them in isolation. And given that I'm probably the only doctor who is involved in healthcare, is there any physician here? Okay, several physicians. I just want to know, given that we're all thinking about innovative ideas to advance the work that we all do, what do we need to do to actually think interdisciplinarily right at the beginning when we're putting the studies together, so that we can, you know, attain more than we can do in our own individual projects? Throw that out.
Well, let me add to that. I mean, one challenge is for us as researchers to collaborate together, move out of silos and look at multi-sectoral, cross-disciplinary approaches. But then that has to translate at the policy level to policymakers working together across ministries and across portfolios. So if the health ministry does not want to optimize their health budget with the education budget, with the livelihoods budget, these complex outcomes that we're looking for are going to be under-delivered. It's easy to deliver a simple outcome. So we want to improve school attendance. We can put in place a simple intervention to do that. We want to reduce income poverty. We can do a simple cash transfer to do that. But true economic strengthening is about empowerment, and it requires a very complex interaction of key policies that are integrated into strategy. And I think it starts here. If we as researchers can show the evidence of how valuable it is to coordinate policies into comprehensive strategies, then we can sell to policymakers the value of working together and integrating policy.
I can share a few notes from our work at the Center for Social Development. We work with quite a few policy makers in different countries and also scholars, and we found that communication is critical. The idea, articulation of the idea is critical. Maybe we're all thinking about the same thing. Maybe we even say the same thing, but sometimes it could be misunderstood. So we found, even for the USAID project, we will articulate what we plan to do with the banks, with the NGOs. We think this is, and we have the writing as well, but it's just, I think people, because they're all working on the same project, they have the same interest, they have the same well-intention, but sometimes they just, because you're in medicine, we're in social work, they're in financial institutions, they're in nonprofit, so that sometimes language could be a barrier, but it's, what we found is the simple, clear communication was critical, and the trust. At the very beginning, especially, people might think, okay, what is there a personal agenda, or is there, what is your agenda, that kind of thing in there. But we found is partnerships with different countries varies differently in different contexts, but we benefit so much from the in-country partners. We found this very effective, and across disciplinary, I think you mentioned,
Yeah.
highlighted quite a lot, very well.
One of the reasons why I asked the question, and this is one of the slides that I didn't show. So I've been doing a lot of work in Africa, and we have a network through the African Organization for Research and Training in Cancer. And after, going and doing this work for more than 10 years, in fact, everywhere you go, I would go to visit the Minister of Health. And the Minister of Health would say, yes, we really need to strengthen our health systems. We need this, but we need money. And I'm not the Minister of Finance. And then we'll go to the university, and we want to engage the university vice chancellor and people who actually are involved in education planning and policy. And they'll say, well, we get our money from the Ministry of Education, and so we can't do that. And so the schools, adolescents, how things are integrated are going to be very important. So this is the African Cancer Leaders Initiative, and we brought all these people from all these countries. And even within the same institution, there are many American universities that are working. I know, I've been in Uganda, many universities working in Uganda, and they don't even talk to one another, right? Because they don't even know what they're doing. So Fred is here, having come from Colombia, but I think what he really wanted me to say, and I appreciated your comment about what is it about the University of Chicago? It's really that we're all on one campus, and you can't avoid each other. You just have to talk to one another. So when you get back home, hopefully, and whichever country you're working in, try to see who else is working there, because that's the only way we're going to get that intersectoral collaboration and partnership that we're looking for.